In this video, we will cover Alzheimer's disease, definition, causes, pathophysiology, signs and symptoms, diagnostic evaluation, treatment and nursing interventions. What is Alzheimer's disease? Alzheimer's disease is a progressive neurological disorder that affects the brain and results in cognitive impairments such as impaired thinking, memory loss, and bizarre behavior. Alzheimer's disease is the most common form of dementia. Dementia is a general term for loss of memory, language, problem solving, and other thinking abilities that are severe enough to interfere with daily life. The cause of Alzheimer's disease isn't known. However, several factors appear to have some association with the disease. These include deficiencies in the neurotransmitters acetylcholine, somatostatin, substance P, that is a type of neuropeptide, and norepinephrine. Repeated head trauma, abnormalities on chromosomes 14 or 21, deposits of beta amyloid protein. Amyloid beta protein is a fragment of a larger molecule that may cause Alzheimer's disease when it accumulates in the brain. Now we'll see the pathophysiology. The brain tissue of patients with Alzheimer's disease exhibits three characteristic features. First one is neurofibrillary tangles, that is fibrous proteins, which are bundles of filaments in neurons that twist abnormally around one another. Neurofibrillary tangles are abnormal accumulations of protein called tau that collect inside neurons. They are most numerous in areas of the brain associated with memory and learning, fear and aggression, and thinking. Because of that, it affects our memory, causing dementia. Next is amyloid plaques. It is composed of degenerative axons and dendrites, also known as senile plaques, are deposits found outside neurons in the extracellular space of the cerebral cortex and hippocampus. Amyloid plaques contain a core of beta amyloid protein surrounded by abnormal nerve endings. The third feature is granulovacular degeneration, or degeneration of neurons in the hippocampus is a process in which fluid-filled spaces called vacuoles enlarge the cell body, resulting in neuron malfunction or death. Next, we will see signs and symptoms. The onset of Alzheimer's disease is insidious, that is gradual. Initial changes are almost imperceptible, but gradually progress to serious problems. Initial signs and symptoms include forgetfulness and short-term memory loss, difficulty learning and remembering new information, deterioration in personal hygiene and appearance, inability to concentrate. Later signs and symptoms include difficulty with abstract thinking and activities that require judgment, apraxia, impaired ability to perform purposeful activity, progressive difficulty communicating, that is aphasia, impaired ability to speak, agraphia, inability to write. The patient may not be able to write properly, severe deterioration in memory, language, and motor function. A classic sign is repetitive actions or perseveration. Patient will be having nocturnal awakening, disorientation, and personality changes such as restlessness and irritability, delusions, hallucinations, aggression, and wandering behavior often occur in the middle and late stages. Hallucinations are sensory experiences that one perceives as real when they are actually not. Delusions are beliefs that are obviously false. Diagnostic evaluation. Clinical symptoms are found through health history, including physical findings and results from functional abilities assessment. Example, mini mental status examination. The patient may have to undergo electroencephalography, computer tomography or CT scan, magnetic resonance imaging, that is MRI, a laboratory test, that is complete blood cell count, chemistry profile, and vitamin B12 and thyroid hormone functions, and examination of a cerebrospinal fluid. Now we will cover treatment. Although there is no known cure for Alzheimer's disease, treatment relies on managing cognitive symptoms. Acetylcholinesterase inhibitors have proven partially effective in improving mental performance. Cholinesterase inhibitors include donepezil, that is Aricept, nivastigmine, Exelon, Tacrin, and galantamine, that is Rasidine. Rivastigmine is available as a patch. Mechanism of actions are acetylcholine is released from the nerve synapses and carries a message across the synapse. Cholinesterase breaks down acetylcholine. Cholinesterase inhibitors block cholinesterase, the enzyme responsible for the breakdown of acetylcholine in the synaptic cleft, thus giving acetylcholine more time to transmit the message. Drug therapy is also used to treat behavioral symptoms such as aggression, paranoia, depression, and delusions. These drugs include antipsychotic drugs such as haloperidol, that is Haldol, olanzapine, Zyprexa, and risperidone, Risperdal. Next is anxiolytics such as alprazolam, Xanax, buspirone, that is Buspar, diazepam, Valium, and lorazepam Ativan. Memantine, an N-methyl D-aspartate receptor antagonist, is approved for moderate to severe Alzheimer's disease. Memantine, or Namenta, protects the brain's nerve cells against excess amounts of glutamate, which is released in large amounts by cells damaged by AD. The attachment of glutamate to N-methyl D-aspartate receptors permits calcium to flow freely into the cell, which in turn may lead to cell degeneration. Memantine may prevent this destructive sequence by blocking the action of glutamate. The drug can be used with the cholinesterase inhibitor because it works by regulating the neurotransmitter glutamate. Treating the depression that is often associated with AD may improve cognitive ability. Depression is often treated with selective serotonin reuptake inhibitors including fluoxetine, Prozac, sertraline, Zoloft, fluoxamine, Luvox, paroxetine, Paxil, and citalopram, Celexa. The antidepressant trazodone may help with problems related to sleep. Now we will cover nursing interventions. Nursing interventions for supporting cognitive function. We must provide a calm, predictable environment to minimize confusion and disorientation. Help patients feel a sense of security with a quiet, pleasant manner, clear, simple explanations, and use of memory aids and cues. Nursing interventions for promoting physical safety. Provide a safe environment, whether at home or in hospital, to allow patients to move about as freely as possible and relieve families' worry about safety. Prevent falls and other accidents by removing obvious hazards and providing adequate lighting. Install handrails in home. Prohibit driving. Allow smoking only with supervision. Reduce wandering behavior with gentle persuasion and distraction. Supervise all activities outside the home to protect patient as needed. Secure doors leading from the house. Ensure that patient wears an identification bracelet or neck chain. Avoid restraints because they may increase agitation. Next is promoting independence in self-care activities. Simplify daily activities into short, achievable steps so that patient feels a sense of accomplishment. Maintain patient's personal dignity and autonomy. Encourage patient to make choices when appropriate and to participate in self-care activities as much as possible. Reducing anxiety and agitation. Provide emotional support to reinforce a positive self-image. When patient feels losing their skills, adjust goals to fit patient's declining ability and structure activities to prevent agitation. Keep the environment simple, familiar, and noise-free. Limit changes. Remain calm and unhurried, particularly if the patient is experiencing a combative, agitated state known as catastrophic reaction, that is, overreaction to excessive stimulation. Improving communication. Reduce noises and distractions. Use easy to understand sentences to convey messages. providing for socialization and intimacy needs. Encourage visits, letters, and phone calls. Visits should be brief and non-stressful, with 1 or 2 visitors at a time. Encourage patient to participate in simple activities or hobbies. Advise that the non-judgmental friendliness of a pet can provide satisfying activity and an outlet for energy. Encourage spouse to talk about any sexual concerns and suggest sexual counseling if necessary. Promoting adequate nutrition. Keep meal times simple and calm. Avoid confrontations. Cut food into small pieces to prevent choking and convert liquids to gelatin to ease swallowing. Offer one dish at a time. Prevent burns by serving typically hot food and beverages warm. Next is balancing activity and rest. Offer music, warm milk, or a back rub to help patient relax and fall asleep. To enhance nighttime sleep, provide sufficient opportunities for daytime exercise. Discourage long periods of daytime sleeping. Assess and address any unmet underlying physical or psychological needs that may prompt wanderings or other inappropriate behavior. Supporting home and community-based care. Be sensitive to the highly emotional issues that the family is confronting. Notify the local adult protective services agency if neglect or abuse is suspected. Refer family to the Alzheimer's Association for assistance with family support groups, respite care, and adult daycare services.